How will the robot advice to cure gastritis? Gastritis is an inflammation of the stomach lining and can have various causes, such as stress, infection, or the use of certain medications. The treatment will depend on the underlying cause of the gastritis. However, there are some general things that can be done to alleviate the symptoms and help to heal the stomach lining. Change in diet. Avoid foods that can irritate the stomach, such as spicy or fatty foods, alcohol, and caffeine. Eating smaller, more frequent meals can also help to reduce symptoms. Medications, Antacids, H2 blockers, and proton pump inhibitors can help to reduce acid production and relieve symptoms. Lifestyle changes. Avoid smoking and limit your alcohol consumption. Stress can also contribute to gastritis, so it's important to find ways to manage stress, such as through exercise, meditation, or counseling. Consult a doctor. If you have any symptoms of gastritis, it is important to see a doctor for a proper diagnosis and treatment. In case you have H. pylori infection, antibiotics will be prescribed. Follow your doctor's instructions. If you are prescribed medication, be sure to take it exactly as directed and do not stop taking it without consulting your doctor. It's important to note that healing of gastritis can take time, so it's important to be patient and stick to the recommended treatment plan. In some cases, gastritis can be a chronic condition that requires ongoing management. How will the robot advise to cure diarrhea? Diarrhea is a common condition characterized by loose, watery stools, and it can have many causes, such as infection, food poisoning, or a change in diet. The following are some general recommendations for treating diarrhea. Hydration. It's important to stay hydrated when you have diarrhea. Drink plenty of water, clear broths, frozen water or ice pops, or clear, non-caffeinated sodas. Avoid alcohol and caffeine, as they can dehydrate you. Diet. You should avoid solid food for a little while and focus on eating foods that are easy to digest and that will help to firm up your stools. Examples include bananas, rice, applesauce, and toast. Diet. Medications. Over-the-counter antidiarrheal medications, such as loperamide, Imodium, or bismuth subsalicylate, Pepto-Bismol, may help to reduce diarrhea symptoms. Probiotics. Taking probiotics, beneficial bacteria, may help to restore the balance of bacteria in your gut and promote normal bowel function. Rest. It's important to get plenty of rest when you have diarrhea. Consult a doctor. If your diarrhea persists for more than a few days or is accompanied by other symptoms such as fever, blood in the stool, or severe cramping, it's best to see a doctor to determine the cause and appropriate treatment. It's important to note that diarrhea caused by some infections or illnesses may resolve on its own within a few days, but in some cases, it may require a course of antibiotics or other medications. How will artificial intelligence advise curing poisoning? Treatment for poisoning can vary depending on the type and severity of the poisoning, but there are some general steps that can be taken to help alleviate the symptoms and prevent further harm. Call for medical help. If you suspect someone has been poisoned, it is important to seek medical attention immediately. Dial the National Poison Helpline or emergency services. Identification of the poison. Try to determine what the person was poisoned with, if possible, and have this information available when you call for medical help. Remove the poison from the body. Depending on the type of poison, the person may need to have their stomach emptied or may require the use of activated charcoal to absorb the poison. Provide supportive care. Depending on the symptoms, the person may need to be given oxygen, fluids, or other treatments to support their breathing and circulation. Follow the instructions of medical professionals. If a person is hospitalized, they will be under the care of medical professionals who will provide appropriate treatment based on the type and severity of the poisoning. It's important to note that some types of poisoning can be very serious and may require immediate and intensive treatment in a hospital setting. It's always best to seek professional medical help as soon as possible when dealing with a suspected case of poisoning,